George Kilpatrick, Inspiration for the Nation. We're pleased to be joined by Vlad Tlali. He is the director of the New York State LGBT Health and Human Services Network. And we're so glad that we are here to find out about a survey that they want you to complete. And they want you to complete it really quickly. So listen, we're going to find out all about this survey about the LGBTQ community needs and how you can help them get some information that I'm sure is going to help inform policy and funding probably around the issues of LGBTQ folks. So thank you, Vlad, who allows me to call him Vlad, for joining us on the program. And let me first tell you that Vlad's last name is spelled Tlali. So Vlad, how did I do? Give me my grade. Give me my grade.
You did it well for being the first time.
Thank you. So Vlad, tell me about this survey. What is it called? And what is the purpose of this survey?
Yes, thank you so much, George, for having us here. Well, this is the 2021 New York State LGBT Health and Human Services Survey, and it's the only statewide survey in the country that explicitly captures the needs of LGBTQ people. It is updated every 5 years. So the last time that we did all of this was in 2015. But then, with COVID and everything, we have some delays, and we are expecting to have the first results in 2021 by the end. But pretty much what we want to do is get information on how we organizations, how we, the government, how we, different coalitions can serve better and support better the LGBT community in New York State.
Yeah, and so what have we learned from past surveys about how we can serve this community?
Yes, thank you so much. I think precisely one of the things that we are deep diving this time. Last time in the last iterations in 2010 and 2015, we have asked about what are the main needs and what are the main services that are out there for people, but we have not inquired so much in what or why people access or do not access the services that are out there for them, right? What about discrimination? What about illiteracy? What about immigration status? What are the things that really prevent people from getting the services that there are for them? Because sometimes you have a lot of services that are available for people and they are funded by the government, so they are funded by our taxes, but there's no information, for example, for people to access it. And we want to know why. What is the role of a stigma, for example? What is the role that the relationship between LGBTQ people historically with the health system has worked? What is the relation with different ethnic groups or different immigration status groups have with the health system? So we have learned that it's not enough to knowing what are the needs of the people. It's not enough to know that we have some services, but we need to know why and how we can enhance the access of these people to the services that are designed for them. So I think that is one of the most important changes that we have now. And the other thing that I want to really highlight this time, that it's very different from other times, is that we're going to be polling people as young as 13 years old. So in the past, we have just started with 18. So at this time, when the rights of many youth in very conservative places in this country are at the center of the political arena, we really want to give them voice on knowing what is happening. So we're going to be polling people from 13 years old to all the way with our older adults also, which are the other range of the community that we really want to deep dive into their needs. So I think that if I would have to summarize, I think it'll be, the nuances. It's not about having access or not having access. It's more complex than that.
Yeah, Vlad, I love the description of that you want to basically open it up across generations, especially where younger folk who are questioning, right? Which is the Q in LGBTQ, right? But there's still space for them to have conversations. Interesting. What I was thinking about, and when you were talking, is probably some of the barriers that exist have to do with your ability to want to seek services in that identity, because part of the struggle, as I understand it, is, if there is a struggle, is coming to terms with your identity and seeking services in that identity. How much of a factor is just coming to terms with that to being able to then seek services within that space, right? Because you first have to say, this is who I am, acknowledge who I am, and then be able to navigate that, and then navigate that safely, right? So
Mhm.
that's kind of what I'm thinking. Where am I on that? How close am I to that?
No, definitely. I think that specifically for certain groups, it gets more and more difficult, right? Like I want to talk, for example, about like transgender men and transgender women who really have a lot of difficulty, just finding medical services that will respect their pronouns, that will respect their gender expression or their sexual orientation, because it's quite complex. So I think like for you to really seek the care or receive the care that you need, there has to be, as you said, like a whole process within like yourself also and within like the system. And the thing is like
Right.
the easier that we make, for example, for people to access mental health services, this will also be more like easier,
Mm-hmm.
and that is something that we're trying to also like with this survey, trying to understand how people can like get the mental health services that they need, and also like how many, because that's the other side of the coin, like how important it is also cultural competency training for service providers, right? And for the government. And how do we need, for example, to also have budget allocated to train more health and human services providers, so that they can provide a dignified treatment and a dignified attention to the clients that come to seek attention based on their own necessities, right? So I think it's like in both parts, and it's something that it's very systemic. And I think like precisely this survey is going to help us like capturing these unique experiences of people. For the design of this survey, we run like 11 or 15 focus groups all around the state where we capture the experience of like different groups of people. We have like transgender people, we have gay people, we have lesbian people, we have immigrants, we have communities of color, Black communities, Asian communities participating in all these focus groups in order to design the survey itself, so that we can capture all of these all of these nuances and complexities, especially in states as diverse as New York, right?
Mm-hmm. Talking with Vladimir Tlali, he is the director of the New York State Health and Human Services LGBTQ Network. I mixed around the letters, but you get it. That's what his job is, and he is and looking for us, all of us, to complete a survey, really capturing the experiences of LGBTQ folk in the community. Now, however, you want everybody to take the survey. Why? Right? Outside of the community and outside of people who are on the spectrum of LGBTQ, why do you want others outside of that spectrum to take the survey?
Yeah, no, the survey is we want people who are within our community to take the survey and to let us know about the necessities, right, that they have. I think like in general, like when people that do not identify as part of the LGBTQ community is it's also important because you actually never know how a person identifies with their own with themselves, right? Like I feel like you cannot assume that a person is what you think they are, or like a person will mostly, for example, there's people that identify as straight but will have sex with men, right? And this is a reality that we have in the health and human services arena. We have like deal for a long time. So there are like other terms that can help, and it's like not, if you don't identify as a gay person, but you still have, if you're a man who have sex with men, that signifies that you can take this survey, right? And you can let us know about precisely your experience because you are, for example, you are sharing some of the characteristics with the community or some of the behaviors with the community that can help in general the community stay healthier.
Do you want cisgender straight people to take this survey?
I feel like that will depend on how people identify themselves, and I think that how people think that their own behavior and their own practices align with the LGBT community. I mean, it's not like a survey for in general health and human services. It's like for LGBTQ health and human
Straight up.
services.
I wanted to get that clarified because
Yeah,
I know that when the survey was sent around, it was like, oh, please send this to everybody. But you really want people to take the survey. It is anonymous, by the way, so that you know. But you want people to take the survey and share it with people and share it in their networks. And the people who need to take it will take it based on their own self-identification. I like that piece of it. But at the same time, if you know that this is not your orientation nor your way of identifying, then the survey may not be for you. Let me be clear about
yeah.
that. Okay. Yeah. So I think that's fine. We just want to make sure. But if it is, we want to be able to provide you with participating in a survey that's going to do what? That's what we want to know. Once they take the survey, how will you use this information? The Health and Human Services LGBTQ survey. I'm adding the Q, but is that necessarily part of it?
Not officially, but we use it.
Okay. So LGBT is what the official. Okay, fine. Go ahead.
Yeah, for the coalition, it's LGBT. For the survey, we use the Q and plus. Actually, it's
Okay.
LGBTQ plus Health and
Yes.
Human Services survey.
Yeah.
I know. But I think like the intention behind, like recognition and the visibilization is what matters more.
Mhm.
So I really thank you also like for making like that precision. And what are we gonna do pretty much is these results really life-saving, right? Like they will guide government and they will guide organizations in identifying and dismantling barriers preventing our communities from accessing the care that we need. So
Mhm.
we really need to identify what are these barriers. It's not that there's not a hospital out there. It's like what is actually making people not going there. What is
Mhm.
actually and that, for example, is like, oh well, they do not respect me my pronouns, or they assume that I have one kind of partner or that I have like one other kind of partner, right? Like I myself, I don't know, in my own experience have had like interactions with the health system that are comfortable and are reconforting, and others that are like I really don't want to experience that again. And I feel like there are more marginalized identities that you can find, sadly, is the worst kind of experience that they will face, while interfacing with the health and human services service providers, right? So what we want to do is like actually deep dive in that and go with policymakers, go with lawmakers, and pretty much say, hey, this is what the community needs you to change. This is where you need to create new policies, to create new protections, to create and help us dismantling it, right? Because like that is your job pretty much. And this is where we need the resources, because there's like X amount of like New Yorkers, and these percentages, and having like the numbers and having the figures, it's like it's not just having figures and numbers and data just because the sake of having it, because it helps us, advancing our own ask and saying it's not just us saying that we have troubles, we have like taken this seriously, and we have like made like all of these analyses that actually justify that you should be doing your work and you should be providing the services. But the other thing is that it's not just for or against the government, right? It's also about how the organizations many times we need to learn and relearn, and people who work at organizations and at the intersection of LGBTQ identities, for example, like we all need to understand and keep learning, because like the world is also moving so fast that we sometimes like may lose, track of what is like the correct way to intervene with people. And that is the thing. Like I personally think that every public policy, every program led by any organization should come from the people that is benefiting from it, should come from a needs assessment, should come from actually identifying the needs, and should always be designed bottom up, right? Because if it comes top down, like it's not gonna help with any sense of ownership. My aim is that at the end, like people will feel that they participated in this survey and it's their data and it's their knowledge, right? And then we're gonna like build kind of policies.
Vlad Tlali is the director of the New York City LGBT Health and Human Services Network. And Vlad, as I'm listening to you, a couple of things come to mind. One, right now, how would you describe this system and how the system is working for or not working for the LGBTQ community? That's number one. And then number two, what is the way in which the system changes? Because it's one thing for us to present all of this information, it's another thing for anybody wanting to do something about it. I mean, you think about how long it took for the LGBT community to be recognized for having the same right to marry, right? In the United States, right? And now, so I'm saying we may give the information to the policymakers, but what
Mhm.
is then needed from advocacy standpoint to make sure that whatever it is that comes across, because now this is a filibuster what I'm doing right now, and I apologize, but I'll reframe and go back to what I'm originally asking you, because here's what I'm seeing, or at least I'm perceiving that while we're trying to understand what the community needs, there are still um, organizations, political interests that are trying to curb the rights of these organizations. Didn't we've seen in some cases, and I can't remember the case right now, but where it was upheld that a business could refuse to make a cake, right,
Mhm.
for a same gender couple because of their religious beliefs or whatever it is. So back to my original question: one, what are the issues right now? Right, it's probably different than what I started with, but what are the issues right now that you're seeing, and then how do you ensure that no matter what happens with this information, that there's a systems change?
Mhm. Mhm. Yeah, no, thank you so much for that. I think like some of the barriers that we can find the most are, for example, like for sure education in general, and for sure a lack of visibilization of people having multiple identities and approaching the system in different ways, like from, I don't know, like for example, like when my friends who identify as lesbian women go to the doctor, like they just assume that they are like doing some kind of like like taking some pills, what's the name? Anticonceptive, preconceptive pills. And it's like, well, yeah, not everyone does that. And that's just like one example, but there are so many examples in which the system is not working for us, like when it is difficult. What I'm talking is about, like, let's talk about like homelessness. Let's talk about people who are in the foster care system. Let's talk about, like children, for example, who have to run away from their families because their families don't accept them. And then they need their permission to have access to to any medical treatment. For example, if they are like TG and CUs, and that is some part of like the just like the tip of the iceberg, right? Because you can find discrimination everywhere. For example, there is like some of the insurance still in New York State. Some insurance will not cover TG and C care at all. So you can find all of these like examples all along the way. From the insurance system to the medical system to like the families also. For example, when the parents, for example, hold the power over children to consent or no to some kind of like interventions that could benefit them in terms of like their gender dysphoria, who has been like pretty much like diagnosed by a professional. I think like we can find many of these, like inequalities. I think like the other part of the question is when you go a little bit deeper and you deep dive into like a more intersectional approach where you start like considering not only like the gender expression or the sexual orientation, but also in concordance with race, for example, and ethnicity in this country. You know, like transgender women of color, like Black transgender women, are one of like the most discriminated groups of people in this country. You know, and in the entire world. So I think like if you go and you start, you know, to like intertwine other sources of discrimination, or what happened with like LGBTQ people with disabilities, for example, or LGBTQ people who are in the carceral system. So I think like that is where you can see that the system is biased, but the system is biased like by design, right? It's trying to keep some kind of people healthy and some people not, and what we're trying to do is precisely to change that. So how do you change that? I think like, and I think like the key, and I have like here like written first, like you got to one of them. It's advocacy in general, activism, organization, like classic call your representatives, classic like make a letter, templates, you know, voting. That's like a whole thing that goes there, you know, in the political big system. But there's another thing about education, you know, education within the communities, education for parents, education for school teachers, education for medical providers, and training. And it is something that it's very important for us, and it's some of the things that we do. We provide cultural competency trainings for schools, for medical providers, for the government. And the communication side is also very important. And it's also something that we try to do at the network. We normally have like one communications campaign. This is what we are doing this year with the survey. But precisely, I think it's like taking several segments of the population who are like going through kind of like the same, you know, the same kinds of discrimination, the same kinds of exclusion, and working together, you know, because we are experiencing similar sources of exclusion. We need to come together, and the survey is a way, you know, of capturing what are the common needs in an aggregated level that will also bring, you know, like this legitimacy by numbers, by objective science, that I don't think it's the only source valid of knowledge at all. I think it's one source of knowledge, but it's a very strong one, and it's one that is very valued within the system we live in. And I think like we value also like the personal experience of the people, and that is why this survey was participatory again by design in all the process. So we also want to invite people to be part of this advocacy process. At the center, we have this coalition called Rise Out, and you can also be a part of that. And you know, like we organize and we pretty much like activate people, you know, so that they can text their legislators, or they can like write a letter or talk with the people that it's needed to be talked.
I go back to this idea of what is the will of the people who we have to convince, right? I think of faith communities. I'm thinking people listening to the show, yeah, but I don't understand, you know, the Bible says or this book says. And I feel like it's almost like, can you really, can you, can you say to folk, yeah, but we need to love everybody and not deny them rights, whether you want to. I guess that's my thing, right? How do we get people that are so headset against, who are headstrong, that they don't approve, right? That's the word I'm looking for. And how do you, what has been your experience around, I'll leave it at that. What has been your experience
Mhm,
around that piece where
mhm,
you're fighting against my approval of
mhm,
all of this? Because to me, that's the barrier.
mhm. Yeah, no, definitely. I think like dissecting, you know, like some of the sources of this discrimination, and these and studying a little bit of the history, you know, of like how social panics have been constructed in the United States in the 19th century as a response of pretty much like all this social and terribly social and economic impacts that this country has gone through since the 1920s, and since the era of the Big Depression, we said we can start seeing the first demonization, in this country of like LGBTQ identities. So I think like considering like how actually, like LGBTQ people go through some or many of the same discriminations that poor people go, that excluded people go based on their race or their ethnicity go. And I think like, like precisely, I do think that it's very similar to when we approach in some way the reason why several races and ethnicities could link together and coalesce together towards their liberation. I think like we should be talking about that, like how the system ends up exploiting us, how the system ends up like marginalizing us. And I think that in terms of religion and in terms of beliefs, like I think like people are entitled, to have and hold their beliefs really deeply. And I think that is one of the values that I really appreciate of this country and that I uphold too. But like when your religion tries to limit then the rights of other people, that's another completely conversation, right? Like these and those don't have to be connected, like the freedom of religion means that you have the freedom of participate in your organized religion in the way that you want. It doesn't mean that you can limit the rights of other people, right? So I think like precisely what I think like historically has happened in this country is that there has been a certain degree of tolerance, in which you are able to express yourself and your religion, and you have this right. And then I think that other thing completely different is that if your religion doesn't accept anything, but do people share your perspective? I think like we should go back to the basic social agreement that there exists in this country about like how people is free to participate and express their religion, but it's not free to limit the rights of other people. Those are like I think like separated conversations. And then it's like, well, if your belief tells you that this is wrong, well, that's okay, and I respect that, and I support that you have the right even to believe and say so. But when believing or think so, it's actually changing the structure so that people that are LGBTQ, and that's happening in many states, in the south especially, and more conservative part, when the state is taking an actually active religious role, trying to prohibit certain kind of things based in some religion. I think that is where we should question the secularity and the separation of power that should exist, because it is when also it's how intolerance grows, it's how precisely violence grows. And we're talking about like tolerance, and we're talking about acceptance of the difference.
I appreciate that, Vlad, and it's certainly well said. All right, here's what we need to do. The survey is the LGBTQ Health and Human Services Network Survey of New York. We'll provide the link for you. And also, if you know of people in the LGBTQ community, please make sure that they send it, or just send it to everybody, and then they can figure out whether they should do the survey or not. But when do you want the survey completed by, Vlad?
Yes, thank you. Really good question. We are extending this until November 7th.
No,
Originally, yeah, we were
November
going to
7th.
finish on September 30th, but we are going to be extending it until November 7th.
All right. So if you see a link, if you know somebody, if you know organizations, groups in the community, they need your help from
Yes,
13 up, right? From
yes.
13 up. Now, where can they, aside from the link, where else can they find this survey?
Yes, precisely. So the survey is available in English and Spanish, and it's also compatible with screen readers for people who have like difficulties visualizing. They can with their screen reader they have they can have a compatible version, and the survey is available at the webpage NYS New York State NYSLGBTQ.org. Again, that is NYSLGBTQ.org. We try to make it as easy.
NYSLGBTNetwork.org. That's where you can take the
Yeah.
survey. It's the New York State LGBT Health and Human Services Network survey.
Yes.
Vlad
Yes.
Tlali is our guest. He is the director of the New York State Health and Human Services LGBT Network. Thank you so much for joining us, Vlad.
Yes, thank you so much for having us, and looking forward to keep talking with anyone that is interested in distributing the survey. We have like Twitter, you can follow us there. We have email, phone. You can find us at the LGBT Center of New York. Thank you so much, George, for the opportunity.
NYSLGBTQ.org. Thank you, Vlad.